I'm really delighted to welcome you to our spring celebration, open house for the MPH students. Today we had about 10 incoming students into the program. We're expecting between 20 and 25 students to join us in the fall. But I hope by now they're already impressed that those who came to visit have made up their mind to join us in the fall. We have a snippet of what we do every Monday, which is to have a seminar series. We have guest speakers from all over the country, sometimes from all over the world. And every other week we meet to discuss what they taught us in the previous week. I think it's a wonderful feature of the MPH program. And many times these are sponsored by faculty members who are doing research in the topic area or have gone out to actually interact with the speaker in their own country. And today's speaker is really my pleasure to meet him for the first time after we've had several months of email correspondence. And the interaction began last summer, I think, with one of our professors, Dr. Susanna Big, taking students to his institute in Costa Rica. Some of those students are here today. And today is also the National Public Health Week. That we're kicking off a series of events that the Public Health Association is putting together for this week. So it is really my distinct pleasure to introduce Director Bernardo Aguilar-Gonzalez, who directs the Foundation Neurotropica in Costa Rica. I don't speak Spanish. He and I started talking a little bit this morning about the role of foreign language in global health. And as it turns out, he knew all about my first name, Diogun. And it's one of those cultural things that you can never shake, and that if you have the excitement to travel around the world, you pick up certain cultural and language issues that will always be of use to you. But he's going to talk to us today about a topic that is very critical as the world changes, population grows, conservation issues become more important, and social and ethnic and economic disparities continue to be at the forefront of what we mean by healthcare. So in this particular case, he will discuss linking social and ecological determinants to public health, case studies of disparities in conservation and development in Costa Rica. Please join me in welcoming Bernardo to public health.
Thank you very much for inviting me. Thank you very much for actually proposing to have this activity and to, let me give you a little bit of my views, my perspective, and what we gathered from our own experience and research back in Costa Rica while we were having lunch. I mean, that is quite a challenge, because I have to deal not only with keeping your attention up, but also beating the alkaline tide that is coming in, if you finish your sandwich while I'm talking. So I really thank both Susanna and Debbie for the effort of having me here and allowing me to share some of this with you. It has been a pleasure to actually be in contact with University of California, Irvine students for the last 3 years since I started having a relationship with students that would come from the political ecology program and now with the public health program. So today, as Debbie was saying, I'm going to be addressing this particular topic, and it will be a way also of raising some interest in the things that I think you can come and do in Costa Rica. Here I'm not going to get as far into the slides that I have some slides of Dr. Vic in the field while she is fighting the mud that are quite interesting. But today I'm going to, with you, I'm going to get to the point where I actually lay out the questions that may be of interest to graduate students and faculty alike. First of all, I would like to ask a license from you, and it is if I may be so bold as to remove my jacket. That makes it much more comfortable.
Your own video?
So, first, just a little introduction about my organization. If you have ever heard of the National Parks System of Costa Rica being one of the most prestigious things that our country has achieved, Fundación Inotrópica, the organization that I direct, was created around the same time as the park system was created. And it was created by 3 of the founding fathers of the National Park System, 3 biologists whose names would not mean much to you if I told them, but believe me that they were 3 of the founding fathers of the National Park System, okay? So we've been around for about 25 years, and we came out with the idea of working on sustainable development around 1985. Around 1985, we would, come to the field and start saying, well, we're working with sustainable development, and they would ask us, well, what is that? So we'd be in trouble. So we would call the United States universities, like this one, and we would call European universities, and we would ask them, hey, can you send us, some definitions and experiences with sustainable development, please? And they would reply to us, actually, whatever you learn, why don't you send it to us? Because we are in the same dilemma right now, okay? And may I remind you that the Brundtland report came out around the late 80s, not in the middle 80s. So we were pretty much learning from mistakes. Our initial idea, was to promote the fair and intelligent use of natural resources through innovative initiatives that promote human development. So we are in the business of apples and oranges. You can find more information on our website. I have a few cards here too. So if you're interested in more detail about our programs and so forth, I welcome you to go there. Anyway, my favorite metaphor as to sort of illustrate what we do is to use this little Venn diagram. Some of you have already seen this because you've been in my course. You've seen this Venn diagram that people have beaten down so many times to say, well, it's an interaction between the economic, the social, and the environmental, right? Any of you have seen it? Yes? No? Maybe? Yes, of course. Well, for us, the important part is not so much the dimensions that are included there, but the fact that in order to be really effective as of sustainability, you need to build it based on the little pieces, okay? And those little pieces are the context, the specific context that you're working with. So be it a bioregion, be it a community, it is about going down to the lowest level of detail in order to understand what really is happening in those contexts, rather than trying to find universal solutions. So in our case, we have chosen to actually go down to that level and try to focus on the environmental conflicts, okay? The environmental conflicts that actually prevent us from attaining sustainability. And we feel that those conflicts come a lot from the unfair distribution of the costs and benefits of sustainable development and conservation. So that's our specific focus. We try to address that through 3 programs: community empowerment, sustainable productive solutions, and global environmental citizenship. I will be speaking a little more about the global environmental citizenship idea this afternoon in the students' meeting. But basically, we are taking the Agenda 21 concept of global environmental citizenship and somehow articulating it and relating it with our own programs. Okay. Just a geography check. Everybody knows where Costa Rica is, right? It's Costa Rica, not Puerto Rico. Okay, so right there. That one. Not the one a little further east. Now, this country had the crazy idea in the middle 90s to actually do something that is very daring. How many of you know what percentage of Costa Rica's land is in protected areas? Come on, that's part of the marketing pitch that everybody, gives you when you're going to Costa Rica, or even if you, call a travel agency.
87.
No.
75%?
No.
50.
No. It's 25% of its territory that is in protected areas, okay? But since about 1996, we made a decision to actually divide the whole country into a network of conservation areas, okay? So how many do we have here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11 conservation areas. Now, in these conservation areas, Costa Rica set itself for the challenge to manage resources bioregional, okay? So it is a mandate of our environmental policy that all of these regions are going to integrate the whole grid of landscapes into sustainable management units that involve not only the protected areas, okay, but also involve the areas where humans are living, including buffer zones, non-buffer zones. I mean, whatever is in there must be managed in a way that harmonizes the goals of development and conservation in the nation. Now, that, is a really ambitious project that actually includes 100% of the country. So the clarification of how much is in protected areas and how much is our project of conservation is important, okay? 25% is our protected area system, but we want to actually manage in a bioregional way 100% of the country. So that has been one of the parts that establishes our reputation as a green republic, or a green nation. Aside from that, we have a few more things. 95.9% literacy rate, not bad for a country that was graduated recently from being a developing nation by the USAID standards of GMP. That was about 10 years ago. Costa Ricans have a constitutional right to a healthy and clean environment. This is something that many countries in the world, including the United States, cannot brag about. We can. How effective is that? We'll talk about that. But we do have a constitutional mandate that allows us to go to the Constitutional Court and sue a developer because they are infringing upon our constitutional right to a healthy and clean environment. Just like in the United States you tried to do when you were negotiating NEPA, which failed. Okay, so Article 1 of NEPA was renegotiated, reshaped, and it ended up being a watered-down focus on environmental impact statements rather than a National Environmental Protection Act. Okay, so many countries in the world would want to have that. Well, we got that in the mid-90s. We have a biodiversity law that actually establishes that all resources from biodiversity are public property. What does this mean? Well, it means that you cannot just go into a Costa Rica rainforest and put a patent on things. Okay? So the benefits of that biodiversity are to be managed and remain for the common of the people that live in Costa Rica or are its citizens. No army. I'm sure you have heard this. It was outlawed in 1948, so it's unconstitutional to have an army in Costa Rica. People who have double citizenship between Costa Rica and the US are in big trouble, okay? Because that poses a whole dilemma. Can you actually refuse to participate in the army based on, being a double national with a country that actually forbids to have an army? I don't know. Kind of a Quaker's dilemma. Anyway, those are some of the things that we like to talk about when we talk about Costa Rica as this enlightened, socially and environmentally enlightened country. Now, healthcare-wise, 79 years is our life expectancy. Not too bad. Here we are. Teeny, dark green. That's us. So that's not too bad. And in fact, we're well known around the world for, the fact that about 150,000 tourists come per year for medical tourism, Costa Rica. Lots of plastic surgery, and other kinds of things that are more affordable. Lots of dental work too, and so forth. Our mortality rate under 5 is also quite high. Quite low. Quite high in terms of our ranking. 94% of births are attended by skilled personnel. Malaria mortality is also very, very low. Great social indicators, okay? And this is the result of historical conditions that brought the country to have a very progressive environmental revolution, if I can use that term, in the mid-90s, and also a very, very strong welfare state after the 1940s. Now,
Bernard,
yes?
does the constitutional right to health include free access to health care?
No, the constitutional right I was talking about was the healthy and clean environment.
Yeah, someone cannot
Yeah. Now, we do have the establishment of an obligation in the same article of the state of procuring the best standard of living to the people of Costa Rica. And our socialized medicine system is a constitutional socialized medicine system. So that creates a right to health. Okay, but it's not the same as a right to health as an article itself. Yeah, it's inferred rather than directly stated in an article. Yes. Nicoya Peninsula, right there. It's one of the blue zones, one of Buettner's blue zones, one of those places in the world that are being studied because people live over 100 years consistently there. Yeah. And you know that Loma Linda here in California is one of those, too. So is Sardinia in Italy, Okinawa in Japan. And there's a whole bunch of conditions that are being studied. I know Susanna, I see like her eyes just, eat nuts. Whole grain, culturally isolated, family, no smoking, plant-based diet. And legumes and social engagement and constant moderate physical activity and all those good things that supposedly make you live longer. They've gone and studied the fact that we have one of those blue zones in our nation. Dan Buettner has gone there and made reports about all this, and it's come out in the press. So, then why do I want to have this talk? Right? Who's familiar with Monty Python's Holy Grail? Right? So it's just a flesh wound? Can we call it a draw here? Huh? Maybe, what, am I the Black Knight? Well, let's look at it a little bit beyond the surface. Costa Rica has indeed a very remarkable socialized medicine system, okay, and it's regionalized to the point that communities have little basic units of attention called EVAIS, okay. Those plus regional clinics, work to have a whole network that then ends up in regional hospitals. This type of infrastructure works. It does exist. Now, if you go to Wikipedia, the source of 80% of the knowledge that all students manage nowadays, you will realize that most of the citations in the section that says Health Costa Rica, the newest of them are from 2002, 2002-ish, more or less. Okay? When it comes to health reporting, if I'm not mistaken. To be up to date is kind of important, right? I mean, if your indicators are not up to date, there's a sign of something that's kind of not too good. Well, this report from 2009 by the Mesoamerican Health Initiative does illustrate to us that indicators, management and administration of data, and use and dissemination of health information are deficient, according to a self-assessment of Costa Rican health authorities. Okay? So we have a problem. Houston. Now, this recent study too by Moreda Salas Melvin, who is one of those hippie economists that appear every once in a while. I count myself on them. Has studied the self-perceived state of health in Costa Rica. And he's found statistical evidence to say that there is a significant difference across the different regions of the country. So it is not the same if I'm in the central urban areas than I am in a faraway area. Now, there are international studies that usually say, well, but those people that don't live close to pollution, in urban areas, usually tend to be healthier. Well, that is not the case in Costa Rica. We don't really have evidence, statistical evidence according to this study, that that is the case. In fact, people that live in urban areas are feeling that they are healthier than people that are living in some remote areas. Why is that? This other study by the same scholar tells us that there is a coincidence between the areas of lower increase in public health expenditures and the areas of lower social development index. Okay? You can see in the graph that the darker areas in the upper one are the ones that have the higher levels of social development. Okay? And in the lower graph, you can see actually the areas where the highest percentage of increase in public expenditures in public health are. Now, some areas, like down here, along the Caribbean coast and some parts of the north, coincide with the areas of lowest social development index. So what is happening? I mean, do we have a problem in terms of the investment that we are making in public health for some special reason? Why? The fact is that it is coinciding with the areas of less social development. This is the disaggregated human development index of Costa Rica. 2005 is the newest information I can find. Okay? The darker areas are the areas of lower human development. The lighter areas are the ones that have higher human development. The indicators, just as the Human Development Index of the United Nations, are life expectancy, education, and material well-being. The largest differences in the case of Costa Rica are determined by material well-being, which is mostly influenced by income. Okay? Now, this is the most urban area of the country. In fact, about half of the population live in this valley, in the Central Valley. Those that have experienced the courses down in Costa Rica may tell you that, you're usually in the Central Valley wanting to run out of there into one of the more sort of protected area, diverse areas of the country. Now, do notice that in terms of income, you also have a pole here. This is mostly because of big infrastructure and tourism development. Okay? So, the same here. This is tourism development too. Touristic development to make areas of higher income than the rest of the country. Now, this is the index of human poverty. Here, dark, again, is bad. Highest poverty rates. Lighter is the lower poverty rates. Notice that some of the area here that was in a higher income also is higher in poverty. This is because a lot of the income that is coming to those tourist areas is actually foreign investment. Okay, so it's generated there. It brings higher levels of income for the area, like a GDP, but it doesn't trickle down to the population. So a lot of the communities that live there have actually a middle-high level of poverty. Now, in the rest, I mean, it basically replicates the same central tendency that we have in Costa Rica, with poorer areas in the South Pacific and away from that central urban area. This is a promotional image for ecotourism in Costa Rica. What can you say about that social landscape? Is it familiar to you? Have you seen it any place close by? I was thinking about this yesterday when you took me to Corona del Mar, Susana. Okay, yes?
Is that the Pacific or the Atlantic?
This is the Central Pacific. Actually, this is Marriott Los Sueños. And, you know, I mean, this is one of those everything included packages places, you know, where you can actually go to the airport, somebody in an air-conditioned van comes and picks you up, takes you down to the resort, you go in there, you know, you play golf, eat well. You can use a beach that has white sand that doesn't exist in this area of the country. But, you know, it's nice, it's good. So they brought it from another side of the country, right? You can go and have a wonderful condo and view in this terraced landscape, which was completely changed. In fact, there was a little forest removed there, you know, in order to make the landscape appropriate. Then you can go down to the marina, take your yacht, you know, out for a ride, and then you can go back, get on the bus with the AC, go back to the airport, and leave. And you've had an ecotouristic experience in Costa Rica. Now, this is I'm not, you know, trashing my own country. I mean, this is something that is being criticized by the Crest Center in University of Stanford. There is a little bit of a tug of war right now between the idea of what does applied ecotourism mean in Costa Rica. Okay, I like to say, well, are we between greentopia and greenwashing? You know, in terms of this particular case. And students come and ask me when I give talks like this one, is ecotourism a solution for conservation? And you're like, okay, well, let's talk about what you define by ecotourism, okay? Because there's different models of ecotourism. Now, in the case of this type of investment, it does coincide with some locations where, you know, some of the most popular national parks are. Part of the influence area of this little resort is this wonderful little spot here in yellow, which is usually said to be one of the favorite places to visit by UCI students when they do our summer course. That's Manuel Antonio. Manuel Antonio National Park. Manuel Antonio National Park and Poás National Park are two of the most visited national parks in the country. Those are in yellow here. And then Irazu volcano. Then you have other areas that have very visited national parks, as is the case up there in the north in Santa Rosa National Park. And you know, the others that are in orange also have quite a bit of visitors. The rest of them are ones that don't have a real emphasis. Now, is the mixture of conservation and investment and development really making a contribution to sustainability in Costa Rica is the type of investment that is being attracted by our natural attractions, really, you know, benefiting all the areas of the country alike? What are the consequences of this in terms of public health? I feel really concerned by the coincidence that I see between the levels of social development indexes, which if they are white, you know, I was telling you, they are low, and the density of protected areas. Look at this. Check this out. This south part of Costa Rica, in the highlands. Here, here, here. Okay? Up here. Now, let's add one more layer. Lots of external immigration is coming to Costa Rica. Because of the higher level of gross domestic product, higher level of jobs are logical, right? Well, that means also that there is immigration from neighboring nations. In the case of Costa Rica, we have 3 larger donor countries. The first one being Nicaragua, the second one being Colombia, and the third one being Peru. Okay? Now, they go to the areas where the standard of living or work is higher. The main exception to that is Nicaraguan workers, which come a lot for agricultural work, like, you know, Latin Americans come here to the U.S. But the fact is that, you know, they are also seeking to find work in those areas of higher urban concentration. Sound familiar? Have you heard of a country that actually has a similar immigration issues? No? Okay, just mere coincidence. Now, intern migration from rural areas is mostly focused on housing and work options. So, housing may not be a stimulus for people that live in the urban areas. I mean, actually, Costa Rica is going through a process of suburbanization like the one that you have in states, you know, like this one, right? I mean, people start with the leapfrog developments, and you start seeing people go farther and farther away because that's where houses are cheaper, okay? But in terms of work, people do tend to migrate, okay, from those areas where there's more protected areas. So, is that sustainable? What does that do to the social landscape of a country? Does Costa Rica want to have a protected area system which actually induces people to get out of there? And then, in case you didn't know, 5% of the Costa Rican population lives now in the United States. We used to be portrayed as this non-migrant country. Well, the fact is that we have 5% of our population here, only here, just here. And everybody says, well, but Costa Ricans are so educated. I mean, it's a real pleasure to have them there. You know, I mean, Costa Ricans come to the US and they all integrate because, you know, they're so well educated and so forth. Well, I can tell you that out of the 250,000 Costa Ricans that live in the United States, only about 70,000 are documented. And, coincidentally, mere coincidence, most of them come from this area of the country. And most of them live, you know this, in Patterson, New Jersey, and in LA, because cultural networks are already established there. You know, just like any diaspora. You start going to where the cultural networks are, right? So that's what we have with the Costa Rican population. So brings us to a situation of great contradictions in the country, okay? And there are a series of examples where you actually see very clearly the bad distribution of the cost and benefits of conservation and development. One of them is this one. Lots of pictures, right? And everything is in Spanish, I'm sorry. But it's an infographic that came out in the newspaper. I'm going to use it to illustrate my point. I don't know if I'm going to have time to go through the 4 slides that to all the slides that I have, but I'm going to try to give you the best with this. This is the Central Valley that I was talking to you about, okay? And in this Central Valley, half of the population of the nation lives. Now, let's look at just one factor, and it is water. Water quality. By all practical means, you could argue that this is the most important watershed in the nation because it provides the water for about half of the country's population, right? Now, there's a little detail, there's a little dark detail about this whole metropolitan area that few people know. And it is the fact that that whole metropolitan area does not have a water treatment system. Okay? So, everything goes to the rivers. All the... Everybody's done eating? All the doo-doo goes straight and raw to the rivers. The problem is so bad that one of the solutions that the municipal government has is that it doesn't allow people to connect themselves to the public sewer system anymore, but they need to build, by law, septic tanks. In order to deal with the problem, well, they actually build a treatment plant. It seems like, that there is right now money from the International Development Bank in order to fix this problem, but they've been saying that the money is there for a while, so we're still, wondering if it's going to be true. The fact is that all this sewage and industrial waste and so forth comes down the stream, into the main river that goes down to this watershed, ending up in the Pacific Ocean. Now, this is the Central Pacific here, and this is a national park called Carrara National Park. Carrara National Park has wetlands that actually do an amazing job at processing all the love that they get, okay, from upstream. And this is why, actually, you have a bridge here that crosses the main road that goes down to the Central Pacific, where you can see these guys. That's, everybody's taking pictures of the alligators. They love to see the alligators. They're huge, big, fat, big crockies. And they take pictures of them. And, if you're even more of a daredevil, you can go down here and you can actually take a boat tour. And if you go on the boat tour, you realize that you're, amidst tons of plastic bottles, tons of tires, tons of, all sorts of solid waste. You actually can go to this, sorry, should have signed off. You can go down, let's let her rest there. You can go down to this little mangrove reserve that is here, which actually provides the service of night sleeping for the macaws that are in Carrara National Park. And you can, go through the mangrove, and in the mangrove you can find women's stockings at this height, or plastic bottles at this height, amidst the mangrove trees. You can see nice pink flamingo-looking birds that are going to be, kind of stepping their way around the trash and so forth. And if you talk to the people that actually live down here in the fishing villages, they'll tell you, you know what? Every day we have to actually go with our boats further out in order to be able to fish. Okay? Textbook, 101 example of environmental justice problems. Costa Rica.
Where does the drinking water come from?
That is such a good question. Wells, yeah. It's impossible to, They do, okay. Around the coast, they do have mostly groundwater is what they use as drinking water.
The septic tanks and drinking water wells.
Indeed. Actually, if you see some of the designs, you know, where the septic tanks are being built for the hotels, I mean, don't get me wrong, but this is a country that has an extremely high water table, like your country. You know, it's a tropical country, and you know that permeability to 100% is, you know, unlikely when you're building septic tanks made of cinder blocks. So they build them made of cinder blocks. There's some permeability that is happening, and you know, sometimes you see a septic tank less than 100 feet away from the ocean. So guess what's happening? We're all sharing love, I guess. I mean, excuse me for being so colloquial. It's crazy. You cannot make this up. Anyway, you know, I'm just gonna fly. I'm not going to talk about this example because I think we're going to consume all the time, but, well, maybe yes. Okay, so wetland conservation in that region where actually I was telling you about, you know, that is the South Pacific region where we have one of our centers. And you're starting to see development that looks like this. Infrastructural development. That river used to flow completely clear into the ocean in a marine national park. You know what that does, right? Who's familiar with dead spots? Erosion with, you know, with the amount of organic material that goes up there will bring, you know, a lot of bacteria into the ocean. The bacteria will start eating the oxygen, okay? And you will have these spots, not every time, but sometimes actually become anoxic, okay? So what happens when a fish swims by? Kapoots, and you start getting lots of dead fishes in the coastline. Well, that's what this type of thing can do. I don't need a PhD in engineering in order to, you know that there's something a little inadequate about the fact that they're managing the construction there, especially thinking about the fact that it's the rainy season. Now, in this area, in this mangrove reserve, okay, we have the threat of that type of development that is advancing from the north. We have the threat of a hydroelectric dam that is being built by the government upstream. These are mangroves. So if you don't know this, they are really affected by the change in the balance of sediments, okay? If they've been receiving a type of sediment for years, then they have an established pattern of sediments. And if you take away that sediment, you're changing the ecosystem. The mangroves are going to start dying, basically. And then somebody came up with the idea that, you know, you need to develop larger scale tourism in the region, and you need to put an airport right there. International airport. And this is between the land wetland and the marine wetland. So right there. Imagine a 747 coming down close to a 70,000 acre wetland. You know what's the problem with that? Birds, there you go. It's going to be suicide lane. Wetlands, the water mirrors attract lots of birds there. They feed, they migrate, they do lots of things, you know. And, you know, I don't know what kind of an environmental impact statement they're going to do, but just by looking where they're putting it, there may be some problems. Anyway. This is the most significant mangrove reserve of its type in the American Pacific. Okay? That's the reserve that is there having problems. So, this is also the area, as I was telling you, that gradually sees more migration. even to the US. Costa Rica has been, for the last months, involved in a border conflict with Nicaragua. Costa Rica and Nicaragua share a huge common border wetland. Okay? This is the Costa Rican side. It's the Caribe Noreste National Wetland. And this is the National Wildlife Refuge of San Juan on the Nicaraguan side. Both are Ramsar sites. Who knows what Ramsar sites are? They're in protection because they are of international importance, okay? According to the International Wetlands Convention. Well, the Nicaraguan government started building a canal to connect the river to this lagoon, okay? I really don't want to side, on who did what right, and the fact that, one is pointing fingers at the other one, and sovereignty is being discussed and so forth. There's even Google Maps involvement in this conflict. Because everything started, according to the Nicaraguan government, because Google Maps drew their border differently than it had been traditionally, and therefore they claimed that that land was theirs. So anyway, without wanting to get into that one, the fact is that it's not too big of an area that is under dispute. I mean, it's only about 500 acres up there, up there. But according to the Ramsar technical report, the impact could be over about 50,000 acres of wetlands, okay? Because they are changing the flow of the river, and therefore they are changing the sediment conditions, therefore they are changing the configuration of the whole wetland. In fact, some Costa Rican natural scientists are concerned about the fact that the increase in sediments here is going to break the bar that used to hold this estuary separated from the ocean, and that you're going to start getting that sediment going with the current, and it will in fact affect eventually the corals of national parks all the way to the south of Costa Rica. Okay? Now, recently, a man from the region where this is happening declared, well, actually, this conflict has been a blessing because they don't have health services, they don't have anything in this area. Back to my point. Okay. Finally, this is a protected area that is actually right next to the city of San Jose. And what happened here is that they created this protected area. This is part of the 25% that we were counting at the beginning. Okay? What happened is that they created this protected area, but they didn't make everything public land. Okay? And that is a possibility according to some laws, just as you have BLM lands in the US, or you have national forests that are not all public land. You can have that in Costa Rica. Now, the only problem is that in this particular area, you have two things. One is that this whole corner is taken by what used to be the dump of the city of San Jose. Okay? And the other one is that a little, well, actually large community of squatters established itself in what used to be a public area. Okay? So, what has been the consequence of that? Well, according to the forestry law, there cannot be constructions at a distance of less than 50 feet away from the edge of a river. There's sewage pipes that come out of there. Okay? You can see here as urban growth is actually starting to push into the protected area. Water pollution is really high. I mean, we have found there significant levels of hexavalent chromium. Anybody know what hexavalent chromium can do to you? Erin Brockovich, cancer. Also, the levels of fecal coliforms are off charts, but that's a minor thing. Solid waste goes all the way to the river. This is a protected area. Okay? So, this neighborhood is called Beautiful View, Linda Vista. Okay? It's all squatters that did a very heroic work in being able to build in these conditions. So, this is my question to you. We feel that one of the reasons why we have this situation in the country is because programs like this one, programs that actually seek to reduce the breach between environmental health and public health, are not developed in our country. We don't have anything that actually does this bridging of apples and oranges in such a systematic and developed way as you all do it. Okay? Definitely, students that help us bring attention to the need to bridge these areas of inquiry is necessary. Definitely, we need to establish baseline studies that do the accounting of apples and oranges together. And don't get me wrong, there are a few approaches that are actually seeking to do this in the country, but it's not widespread. It's not internalized by any means into the research agendas of the main research institutions of the country. And over there, develop intersector policies that benefit conservation while improving community quality of life, and endogenous development options consistently are needed. Some of the conservation efforts in Costa Rica were established with the what I call the US model, okay, basically, which is to put out a representative piece of landscape without taking into account the fact that people are actually close or nearby, the Yellowstone syndrome. Some people actually call it the sheriff syndrome, right? Sheriff walks into the saloon, shoots everybody, and then says, this town is really calm, everybody abides, by the law. Some people say that that's how some of our parks were created. We feel in the sense that, having the synergies of those who are working in ecosystem health with public health and transdisciplines as political ecology, for instance, would be something that would really, really be key to actually be able to tackle contradictory issues like the ones that I've pointed to you, and to definitely make Costa Rica to lean on the way of Greentopia. Okay.